Hi, I'd like to welcome you to our next video about the final day's closing argument in the Johnson & Johnson ASR case from Australia. Corinne and I'd like to thank everybody for your patience and understanding. It was a harrowing week last week, and it has taken us a little while to get this video together. And I also ask for your understanding and patience. This video will take a little bit longer than the others because we've got a lot to get through, and I apologise ahead of time for referring to my notes as well. On Friday, we had the rebuttal for the closing argument against Johnson & Johnson by counsel representing the patients here in Australia. It was quite harrowing to sit through, as had the many days and weeks beforehand for the people that had been there, but I think it's important that you understand and get a picture of the way this all panned out in the end. One of the statements that was firstly rebutted was that Johnson & Johnson, in their defence, had made a statement that it's just bad luck that all these patients picked the ASR hip. Our counsel found this to be illogical and irrational, which I tend to agree with. In evidence, a DPI executive said, when referring to the box that was ticked on the recall notice, which we addressed in a previous video, that I stand by ticking that box, which even His Honour recognised with a raise of his eyebrows as being a key piece of evidence in just how lightly and incorrectly Johnson & Johnson had taken the failure of this device. Our counsel pointed out that Johnson & Johnson had shown an inability to identify root causes for the defection or the defectiveness of the device. They issued an urgent field safety notice, first part of the problem. This was followed up by an urgent medical device hazard alert, which was fairly quickly followed, ultimately, by the total recall of all ASR devices. Our counsel were quite rightly able to say, well, if Johnson & Johnson didn't have an idea that this device was defective, how is it that they were able to issue these three warnings, particularly here in Australia, if there was nothing wrong with the device? In their recall notice, Johnson & Johnson pointed out that they would cover the costs for all treatment and monitoring of patients that had had an ASR. The effect of the decision to recall was the reason that most people wanted the device out of their body, not the recall effect, as Johnson & Johnson had quite insistently placed in their defence. This, as our counsel quite pointed out, is a passive admission. Counsel then talked about the introduction of a third-party claims processing group in this country called Crawford & Co. In this process, all you simply had to do was prove that you had had an ASR. It didn't have to have caused you any problems, but if you had an ASR, Johnson & Johnson were willing to pay for and reimburse costs for treatment, testing, and associated costs for having had the ASR, and if it then needed to be removed, subsequent removal. They also pointed out in this same notice in the patient consent form that patients did not waive their right to pursue legal action against Johnson & Johnson over the recall and any subsequent device failure. Again, Johnson & Johnson were aware and were prepared to act around the ASR. This became a unilateral admission, according to our counsel, and they also pointed to that unilateral admission to being a cause of fault. Their chain of conduct that they carried out through this process was reflective of their recognition that there is a causal link to device, not only the device failure, but their, as in Johnson & Johnson's, responsibility for that device and its subsequent failure. This is not the conduct of an uninformed or misguided party. I'll repeat that. This is not the conduct of an uninformed or misguided party. Johnson & Johnson were acting with knowledge. Again, I'll leave that up to you. Their claim was that we all rushed out and had revision surgery because we'd seen it in the media or we'd read a recall and gone into a mad panic. Council quite rightly pointed out that in this country and many other countries, I have no doubt, that you can't talk a surgeon into just removing a device from you because you want to. They quite rightly pointed out in evidence that all revisions were carried out after proper clinical judgment and review. Again, the recall effect is null and void. The media did not cause us to go and have these devices removed. The devices were removed because they were harming patients and patients were getting sick. For all the words that they used around the recall effect, the device wasn't functioning properly. That is why the device was removed. Not because of the media, and certainly not because we all saw some notice and rushed out and had the thing pulled out of us. It was stated, quite simply, that it is reasonable for the recipient of a hip implant to expect it to last for 20 years. Johnson & Johnson actually used statements such as this in their advertising for the ASR. So why is it then in their own closing statements that they weren't prepared to look beyond 5 years for that device? If you went into a surgeon's office for a hip replacement and that surgeon said to you, it will last 5 years, I don't believe that you would go through the trauma and the associated pain and suffering that a device that may only last 5 years would cause. A further suggestion that DePie made, which our council addressed, was that they suggested that the manufacturer is never wrong and that the consumer should accept that risk. They used a statement along the lines of that they were providing the science and that we should just be accepting that by taking on that science that we were taking a risk as patients. I don't believe that the laws in this country were designed to protect the manufacturers in that way, and I certainly don't believe that our council felt that way either. The recall effect. They mentioned it a lot, so I'm mentioning it a lot. It is not real, because if you have a faulty or defective product that has an increased risk or has been demonstrated to have an increased risk, you have the right to have it removed. Johnson & Johnson would have you believe that even though there was a recall and even though there was full evidence that this device was defective, that we should be happy to leave it in our bodies. Again, I'll leave that up to you. Quite simply, ASRs had a massively increased risk of revision, not to mention all of the many other side effects that have since been proven to be related to it. And Johnson & Johnson believe that we should keep them within our bodies. Our council stated that unlike the recall effect, as they referred to it as, that all patients had a right to have them removed. It was then pointed out that it is completely illogical to consider that an implant known to be effective should ever be expected to stay in a person. Council was very strong on this. And the point that they then led to was that Johnson & Johnson had breached their duty of care under the Trade Practices Act in this country by continuing to market and sell this device when it was known to be causing harm to patients. Yet again, a further example of profits and sales over patient safety. In arguing, DePie used the examples of the applicants, the two lead applicants in this particular case, and claimed that they had poor prognoses and that putting an ASR into them was just adding to that risk. It could be argued, and it was argued, that the ASR was not only applicable and appropriate for those two patients, but that the one patient in particular had an ASR metal on metal device placed on their right side, and on their left side they had a pinnacle ceramic on ceramic hip placed. It's ironic that to this day not only has the ASR been removed and there have been incredible complications for that patient on their right side, that the Pinnacle ceramic on ceramic implant is still in situ on the left side and working perfectly. This brings me to a further point. Under Australian law, witnesses can only be called in a case such as this if the people that are the respondents in the case, Johnson & Johnson, wish to cross-examine them. To avoid having a patient take the stand in this case, Johnson & Johnson refused to cross-examine either of the plaintiffs, or any patient for that matter. Our counsel pointed out that this was quite possibly because they did not want the judge to see the personal cost or the personal toll, or hear the personal stories of what these hip implants had done not only to the applicants but to the many thousands of other patients involved. Again, Johnson & Johnson have utilised the legal system in this country to their advantage. However, it seems to have blown up in their face a little bit, because our counsel was quite willing and able to prove to the judge that that was the only reason that we did not have a patient take the stand in Australia. It's appalling that nobody got to tell their story in front of the judge. However, I can assure Johnson & Johnson that there are plenty of us that are willing to tell our stories, and the affidavits alone of the patients involved and the many other patients in the case have been presented to the judge. The case moved further in rebuttal, and they got on to the expert witnesses. There's some things I'd like to draw your attention to here. Dr. Anthony Nagel was a witness on behalf of the plaintiffs, and he pointed out that not only was the pathology that was removed from the two patients in question damning, that he was able to prove that medical particles and wear debris not only penetrated the local area, but they were also able to penetrate bone. As I showed you in the pictures of my own surgery, there was very clear evidence of where metallosis, a term that was never used by Johnson & Johnson in their discussions, had penetrated the bone right through the thickness of my femur. Excuse me. It was also pointed out too that by paying for expenses related to the ASR, again, this was a passive admission of liability on Johnson & Johnson's behalf. They countered this by saying that no reasonable consumer would expect that a manufacturer would be expected to provide a safe and quality product. Now that was a direct quote from the statements made by their counsel in their closing on Tuesday and Wednesday. In cross-examination, it was proven that the biomedical engineer that Johnson & Johnson utilised to rebut our case was not actually qualified to give evidence as a biomedical engineer. It was also proven that their statistician, who had been utilised to rebut the evidence of Professor Stephen Graves from the Australian National Joint Replacement Registry, had manipulated his statistics or her statistics to reflect the ASR, particularly the ASR Karai stem, in a positive light. What they neglected to mention, and what was proven in our rebuttal, was that those statistics had been measured against the poorest performing device in the category. So of course the ASR would look a little better. However, when looking at those statistics, the ASR was still the worst performing device in the category of MOM devices. Our counsel brought up the point of engineering truisms when discussing the defective nature of the device. And they pointed out that the defendants went to great lengths to resist engineering truisms, which merely pointed out their actual fear of these engineering truisms. And even when using their own weighted statistics about the ASR, particularly with the Corail stem, this device was still the worst or most poorly performed of all metal-on-metal devices. The final thing I would leave you with from the closing arguments is that all Johnson & Johnson felt that the pain and suffering of the two plaintiffs in particular was worth was $50,000. Under Australian law, There is limits around these figures, but that limit sits at around $320,000. Our council challenged their council and the company themselves to undergo a hip replacement operation, particularly a hip replacement revision operation, and see if they felt that all of that pain and that suffering that would result from that was indeed worth $50,000. I think not, and I certainly know that the many other patients that were present in the room agreed with that sentiment. The final thing in closing that our council did was point out that not only was it the two people that were the lead applicants in this case, that there were not only other people in the court who had been harmed and made disabled by these products, but there were many thousands of other people in Australia, and indeed hundreds of thousands worldwide, that this technology, this device, along with many other metal-on-metal devices, is responsible for the harm of hundreds of thousands of people. In this case, we believe, certainly from what we've witnessed, that the case against Johnson & Johnson has been well proven. It is now up to a judge to decide. Obviously, we'll have no say in that, but it will be his decision in the end. We met some wonderful people when we were in court, and I'd like to indulge for a moment a young gentleman who had been there for every day of the case. His father has been affected by this device, and he handed me this piece of paper on the final day and asked me if I would read it. So Stephen, you know who you are. I'm reading this for you, mate. The hidden side of the hip. Family life is not meant to function this way. Hold, freeze, cease the moment a member of the family has been fitted with a device that is eroding in their body. Someone's dad, mum, brother or sister. Things have changed quickly. What is going on in the family unit? Life is under attack. The families of the effects of the hip are the warriors of this orthopedic trauma. Families have seen for many years patients suffering pain, depression and anxiety affecting their loved one's health. Crutches, wheelchairs, walking sticks, so many stories. Is this God's waiting room here at Federal Courtroom 18D? Professors and doctors from all over the world tell their stories about the prognosis of the hip failure. After so many years of not knowing participants in the class action, families' loved ones walk into court. After saying hello and getting to know these wonderful people, each person has so much to unload about how their lives have been affected. Professor Petrie from New Zealand told the court that at the time of the hip implant and revision, patients would experience worries and negative feelings, which is anxiety. In today's world, anxiety is a mental condition that can lead to other severe neurological conditions. For many years, pain, depression and anxiety affected life for families and carers like a trauma. With today's technology in this modern world, how did a company leave people with a disability like the ones seen walking into the Federal Court of Australia every day? Dr. Cutler told the court that when a hip implant is implanted into patients, muscles and tendons are pushed aside to fit the hip implant in. Dr. Cutler explained to the court that this procedure in the orthopedic world is what is called a controlled trauma. When the hip implant starts to fail inside a patient's body, is this still a controlled trauma? Or maybe the patient is traumatized? As I said, these are the words of a gentleman who was there watching his father deteriorate. In fact, he believes that he doesn't actually have long to live. And Stephen, I thank you for what you wrote because it moved me to tears. Thank you very much for your support and your understanding and your help in helping us to get this message out there. Corinne and I have endured 3 of the most harrowing days that we've ever endured through this whole process, and again we apologise for the delay in getting this up. But surely you'll understand that after hearing this and imagining sitting there listening to it firsthand, that it was pretty tough stuff. Thank you very much again, guys. Please share this with as many people as you can, far and wide. It's amazing the response we've got, and I can assure you that it is being heard in places that even I didn't think it would be heard. Continue sharing the story. Thanks for your support, and we will be talking to you again soon.